I'm Liz Casiela, and your Skyline Scoop starts right now. Good morning, Raiders. Today's Wednesday. You know what that means, Green Team Pickup Day, so leave your recycling outside your classrooms. Now let's get right today with reminders. Today is the Skyline GSA meeting, so don't forget. And Sen is collecting new and gently used books for children, so please leave your donations in G53A. The Art Intensive will be hosting a free one-week art course. Interested students can see Mrs. Cross in G27. The applications are due April 11th. Attention Class 2021 students. If you're interested in enrolling in co-op for the year 2021, here's your QR code. And use the QR code to join Senate if you're interested. Now let's see what Martin and Gerald T. are up to.
Hey cadets, Binal here. This week we'll be talking about the big inspection that happened on Wednesday of March 4th. So let's talk about that. Alright, here's what the inspection is. It's basically sergeants from schools come to JRTC to ask us uniform questions. But that's the battalion inspection, so they inspect all the company/classes. The other type of inspection is the battalion staff inspection. This one is where they inspect them on what they did as staff, like that angel tree project that we did last semester. That was a fun time, actually. Well, the results came and we got the stars, y'all. Give yourselves a hand, man. Sorry if y'all got nervous when the sergeant major came to inspect y'all. He's used to inspecting soldiers, you know, not high schoolers. But hey, that's why we do inspections on uniform days. So when that day comes, you want the sergeant major to take his time with you and be like, you kidding me? I know you did these questions, sergeant major. And also sorry for us juniors that wasn't there. We had to do the SATs.
Thank God.
You're welcome.
But hey, let's take a look at some of the highlights, shall we? That's it for this segment, cadets. I'm proud of y'all for getting the stars. I'm Martin Pinal, sign off.
It's Women's History Month. Let's take a look at one of the greatest women in history. Now to you, Clarissa, with today's weather.
Good morning, Skyline Raiders. I'm Clarissa here with your weather for today, Wednesday, March 11th. It's a cloudy day today with a high of 83 and a low of 68. And tomorrow it's going to be a cloudy day with a high of 85 and a low of 62. That's all we have for today, Raiders. Check in next time for more weather with Clarissa.
Let's see who's reporting lunch.
For Wednesday, bean and cheese nachos, ham and cheddar sandwich, green beans, taco topper, pineapple, fresh grapes, pico de gallo.
Here's your A segment.
Hey guys, what's up? Welcome back to my channel. Thank you so much for watching. So in this video, I wanted to talk to you guys about the coronavirus. This has been the cause of near mass hysteria, especially in the healthcare setting, but definitely outside and in the general population. People are really worried about this. And, I think it's mostly because we are not well educated on the virus and how it's gonna present and how it spreads, and what would be the effect on you, a potential carrier or infectee. So basically, the coronavirus has been out there for a long time, but what's new about this one is that this particular strain has been causing a lot of major respiratory complications, and that basically means problems with the lungs, right? So there is going to be more concern for bronchitis, pneumonias, and things like that. And usually people who are at the extremes of age are more affected by lung diseases and less likely to recover, hence the fatality numbers. So the virus is being called currently SARS-CoV-2 or COVID-19, coronavirus disease 19, since it was first identified in December 2019 in China. So it was originally found in Wuhan province of China. The areas of most dense infection are, in addition to China, South Korea, Italy, Iran, and Japan. As of early March, so like a couple days ago, this is the last updated information from the CDC. So how will you know if you have COVID or coronavirus? So the most common symptoms are going to be fever, cough, and usually it's a dry cough, but sometimes it can be productive, fatigue, and last piece that makes it most dangerous, the pneumonia or the respiratory symptoms. So you feel really short of breath, it hurts when you take a deep breath, and maybe you feel like you just can't breathe at all. So those are going to be like the most concerning symptoms, and if you do feel that way, you should present immediately to your nearest emergency room. So what we do know is that children are more likely to have a mild form of disease, which is great because I have little ones and I'm always nervous about that. Bringing home something to them and infecting them is a major stressor for me, but the more likely population that's going to be affected by this would be like the elderly or people who are immunocompromised or have already a depressed immune system for some reason. So maybe they're on drugs for that, maybe they have cancer and they're on chemotherapy. Pregnancy can be a cause of a state of immunocompromise. So those patients need to be very careful about noticing these symptoms early and presenting for treatment early. So as a point of comparison, the regular seasonal flu has a mortality rate of 0.1%. So in comparison to that, COVID or coronavirus has a mortality rate of about 2%. So that's why everyone is up in arms and pretty nervous about it. But we all just need to be cautious about how we go about our regular lives. Take universal precautions, wash your hands, cough into your elbow or sneeze into your elbow, not into your hands. And if you do feel sick, go to the hospital. If you have a fever, especially, just because you want to have this identified quickly and you want to make sure that you don't infect others in your home and in your community. So last but not least, if you have traveled in the last 2 weeks and you are feeling symptomatic, please do go seek medical help. Me, as a healthcare provider, someone who is at basically the front lines of someone who will come in with any respiratory compromise, as an anesthesiologist, I'll be the one that they call to help support the breathing if the patient needs to be intubated. I will be wearing my personal protective equipment as I usually do. So that means a mask with also eye protection. And then I will also have a gown on and always gloves as per usual. So we'll be seeing cases for sure in my hospital. As a level 1 center, we get a lot of referrals. We've all been educated on how to treat patients with this disease. Even though it's scary, education is powerful. So knowing what to do in those situations will help us to treat people safely and also to prevent ourselves from also being affected. So with that being said, don't be nervous, don't be scared, but just be safe. All right, until next time, I'll see ya. And don't forget to like and subscribe and leave your comments below. And remember, the CDC does not recommend that you wear face masks in public to prevent respiratory viruses from being spread. It's about hand hygiene and also covering your cough and your sneeze. When I am out there and I see people coughing out, no, not the time for that. Please, people, cover your cough, cover your sneeze. You'll keep this disease from spreading, trust me.
That's all for today, Raiders. Follow us at Skyline Broadcasting on Instagram to stay updated with school news and see behind the scenes of Skynet. And to catch your daily scoop, make sure to log on to skynetbroadcasting.org. I'm Liz Saylor with everyone that brings Skynet news. Thanks for watching, and we'll catch you next time.